Joining us live now is Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, Happy New Year. How are your holidays?
They were okay, Jen. Happy New Year to you. I worked over the Christmas block and then had some time off over New Year's, and it was great, very relaxing. Hope you had a good one as well.
Yeah, I did. Thank you so much. Well, we're glad you're back, and we're going to dive right in. You tweeted that respiratory illnesses are on the rise in Canada once again. What are you seeing, and what's the level of concern here?
Yeah, I think to no one's surprise,
Uh-oh.
we're actually seeing right now. But you can see that, COVID, RSV, influenza are all on the rise. And certainly when you look at from a hospital standpoint at this point in time, we are seeing pretty significant influenza A activity, which is what we'd expect. We're also seeing, of course, RSV and COVID, not as much COVID as we would expect for this time of year based on prior winters, but it's certainly still around as well.
Okay, definitely something to be aware of. And Dr. Theresa Tam has said that she has a couple of concerns as we enter the new year. One is bird flu and the other is measles. Do her concerns align with yours at the moment?
Yeah, and we've been talking about this on the show periodically for months now. I mean, bird flu or avian influenza or H5N1 is certainly a major global issue. Fortunately, we've only had one human case in Canada. Unfortunately, that was a very severe case. And the reason that's on the radar is because it has epidemic and pandemic potential. And there are, pretty large outbreaks in non-human mammals across the world and spillover events to humans. So something to watch for sure. And then measles in Canada. I mean, we've had 2024 was a bad year for measles in Canada, more cases compared to prior years. We saw the importation of a few cases. That's going to happen. That's inevitably going to happen. But the concerning part is we saw subsequent transmission within the country, which we should really be avoiding. Remember, the first dose of a measles vaccine is given at the age of 1. So all those kids under the age of 1 are not protected. But we saw transmission in people who were over the age of 1, people who should have been vaccinated or had 1 or 2 doses of a vaccine, and that's problematic. We should have high enough rates of measles vaccines in the country such that we don't see subsequent transmission when we see imported cases.
Dr. Bogoch, just circling back to bird flu, yesterday the U.S. confirmed its first human death from avian flu in Louisiana. I know the patient was 65 years old with underlying medical issues, but they analyzed the virus and found that it had mutated inside the human body. I know that the risk is low, so we don't want people to panic, but this mutation in the analysis that was found, is that something that could potentially translate to, I don't know, potentially a human-to-human transmission in the future, or we just don't know enough yet?
No, that's exactly it. And to your point, exactly, right? If we look at Canada right now, one case of this virus. Okay, if we look at the United States, there's about 66 cases in humans of this virus. We don't currently have a human epidemic. We don't currently have a human pandemic. That's exactly what we're trying to avoid. But the issue is you can see the virus as it enters mammals and spills over from birds. It's adapting. It's adapting to mammals, right? It's not very easily transmitted from person to person. It just isn't. But we don't want to give the virus opportunities to adapt to human hosts such that it is more readily transmitted from person to person. And you can see the virus doing exactly what you'd expect it to do in human and other mammalian hosts. It changes and mutates in a way that it can more readily invade and replicate within mammalian cells. That's a problem, and that's why we have to quell those outbreaks on dairy cows in the United States. Canada doesn't have a dairy cow outbreak, but the United States has a dairy cow outbreak, and quell outbreaks on poultry farms whenever we see them as well.
And we definitely don't want to see it spreading. Okay, Dr. Isaac Bogoch, that's our time this morning. Once again, Happy New Year, and thanks so much for your time. We'll chat again soon.
Thank you. Have a great day.